Wonderful. It looks like we've all transferred over. Congratulations and making it to this next room. Without further ado, please let me welcome you to the Keynote Presentations session. I have been so excited for this, and I'm sure when you hear these speakers, you will be so motivated and you'll have plenty of questions, and we'll get to that after during the panel discussion. But first, let me please introduce you to Dr. Sharon Deem. Our first keynote speaker, Dr. Cheryl Deem, is the director of the St. Louis Zoo Institute for Conservation Medicine. In addition to global One Health and conservation medicine research projects, Dr. Deem is training the next generation of One Health practitioners. And not only that, but in 2018 and 2020, Dr. Deem delivered 2 TEDx talks on One Health. If you haven't seen them yet, please see them because they're really exceptional. Dr. Deem has worked for the Wildlife Conservation Society and Smithsonian National Zoo as both a clinical zoo veterinarian and a field wildlife veterinarian. She has also worked in the Galapagos Islands as the veterinary epidemiologist for the zoo's Wild Care Institute Center for Avian Health in the Galapagos. She's also written a book. So much to say about Dr. Deem, but please let's all welcome Dr. Sharon Deem.
Wonderful, thank you. I love seeing all the icons coming up and the claps, and I haven't started. So please go to the next slide. I really thank you to Gordon and LaShawn and the organizers for allowing me a few minutes with you. I will be presenting on the animal health part of the One Health Triad. I'm so excited to be meeting and talking with my esteemed colleagues in this session. So let's go to the next slide. As Dr. Thompson said, I just wanted to share my path into One Health. And so both from the educational side and more the experiential or personal side. So I am trained as a veterinarian. Animal health has been in my blood since day one, I think. I also have a PhD in veterinary epidemiology, and my career has really been focusing at that intersection of animal, human, and environmental health. I've been a private practitioner in the US, as Dr. Thompson said. I've worked for some of the most amazing zoos on the planet, both with collection animals as well as free living animals. And over that time, I've been fortunate to work in many places around the world and a number of years in academia training the next generation. So let's go to the next slide. But I also must say my real path started with television in the 70s. I grew up watching Tarzan next. I also grew up watching Jane and her career. And then lastly, I have to say, I knew medicine was always in my blood. So a number of poor stuffed animals, which we call posh animals now, plush animals, had a number of veterinary and doctor surgeries performed on them. So I really think the educational and experiential side of just growing up and seeing the concerns of the world really put me on this One Health path. Next slide, please. But I also did grow up in the 70s, and that was the decade where we first saw this amazing planet, this living planet. Rachel Carson had just written or published her book, Silent Spring, and the environmental movement I remember so well in my teen and college years and really helped move me into this path in One Health. So let's go to the next slide. But why One Health, right? Why this amazing conference and the many different One Health venues we have around the world today? And unfortunately, it's a crisis-driven approach now, right? We know we have these shared greatest threats that are impacting the health of humans, animals, plants, our very existence on the planet. And I've listed here sort of those greatest challenges and threats. I will say my PhD really was focused on the food security question that I hope we get into during the panel. But let's go to the next slide. And really my career has been generated, I think, by seeing the real loss of biodiversity that is being experienced around the world today. This WWF report from last year, Open Access Online, it reminds us how we humans have led to the loss of extinctions, extirpations, population declines of animal species around the world, for sort of this list of the usual suspects, right? So that really has been what has targeted my focus within One Health. Next slide. So now, as was pointed out before, I've been fortunate for the last 10 years to run a program at the St. Louis Zoo, the Institute for Conservation Medicine. If you see in green there, the mission statement, we very much take this One Health approach for wildlife conservation, human public health, and environmental sustainability. And increasingly, we are seeing NGOs and other organizations that are having the ability to form these One Health programs. Next slide. And I'm just going to share quickly the three focuses, I would say, of where my career has taken me over the last decades. And on the left there, you see, the bottom line is wildlife conservation and health with emphasis on this interconnection across that triad has been what directs the work I do. And I'm going to share three parts of that, which I think are all really important as we work within One Health. So much of what we do is just what I call boots on the ground research. Much of this is health assessments, health surveillance, looking at some of the disease and threats that are impacting the ability for conservation of biodiversity across the globe. Next slide. The second part is outreach has become increasingly important, I think, in this day of misinformation and disinformation. I think appropriate and proper outreach and education is going to be the key to moving forward to answering the solutions to some of those greatest challenges I presented before. And then lastly, next slide. All of this really is not going to get us anywhere if we don't move it to action. And for my group, for the people I work with, conservation action is really top on that. And I share just one example of work I've been doing with our PhD student on antimicrobial resistance in the Galapagos Islands. Our next speaker is going to share a lot about antimicrobial resistance. But I think the real point is we take our science, we publish it, we do outreach and education, but we really have to use that to make the recommendations, make the management changes that are so important if we are going to have that science turn into conservation or public health action. Next slide. So in summary, before our next panelists go, and then we get into some good conversation, I hope, I really have looked at my career from a One Health perspective, even before the term One Health was assigned. So my patients include this beautiful bull elephant in Gabon. If you notice, there's a snare around his leg. We're in an oil field. He is my patient. Next. These children around a park where I work in Madagascar, they live on the edge of this national park. They are my patients as well. And lastly, next, I really think we all, whatever discipline, whatever part of One Health is our passion, have to look at it as planet, as patient, as the ecosystems, the very ecosystems that give us life and health are our patient as well. Next slide. So thank you. I just wanted to give a brief sort of my philosophies and background in One Health before I joined the panel. If you're interested, we do have a book out, Introduction to One Health. I think it's very readable and a great introduction for people. And my information's there, as LaShawn keeps reminding us. Please, 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 let's connect. And I look forward to talking with you all and my panelists after we hear some other speakers go forward. Thank you very much.
Wow. Wow. Let's share our love. Let's see some hearts out there. Let's see more applauses. Dr. Deem, that was incredible. Thank you so much for sharing your story and your passion. And totally agree with your mission. And I'm very happy that you already have those 2 TED Talks out there. so that more people outside of our bubble can share this passion and we can all move forward together. Yes, I'm loving these hearts and all these emojis. Keep it going, everybody. Love it. That's from around the world, Dr. Deem. That's incredible. Okay, well, without further ado, please allow me to introduce our second keynote speaker, who is Dr. Kamani Walia. She is a microbiologist by training and has subsequently been trained in public health from Johns Hopkins University. She is currently working as a senior scientist in the Division of Epidemiology and Communicable Diseases Division of the India Council of Medical Research. That is huge. If you don't know about that, look it up. Indian Council of Medical Research. Dr. Walia's experience spans working on infectious diseases, including HIV, AIDS programs, and health technologies. Dr. Walia is currently leading the Antimicrobial Resistance initiative of the Indian Council of Medical Research. Again, everybody, that is huge. This focuses on various aspects of antimicrobial resistance, including surveillance, antimicrobial stewardship, and One Health. Without further ado, let's all please welcome, show the love for Dr. Kamani Walia.
Good morning, everyone. And thank you, Dr. Thompson, for introducing me and a very generous introduction. I'm grateful to organizers, the Public Health Insights and the Health Innovation Initiative for giving me this opportunity to share the Indian experience on antimicrobial resistance and all the initiatives that have been taken in my country by my organization and by myself. So Dr. Deem gave an excellent overview and set a stage for further discussions on antimicrobial resistance, which is one of the very important topics for which One Health actually got prominence in last few years. There were two major public health challenges because of which One Health came into a lot of prominence, although it has been important for many years. One was the viral outbreaks, which many of them we have experienced, and we are currently in middle of a pandemic. And the other most important aspect, which has been around for a very long time, yet it did not receive much attention and was neglected all this while, that is antimicrobial resistance. Next slide, please. So why is it so important right now? I have been working in this space for almost 20 years. I have worked with HIV/AIDS programs. I have worked with diarrheal diseases. I have worked with different kind of health technologies during my work in PATH. Most of it has been around infectious diseases. However, the nature and the way infectious diseases have transformed in all these years, and the zoonotic infections, antimicrobial resistance have become so important. And most of the time, we are only dealing with the human and the clinical aspect of zoonotic infections or antimicrobial resistance. While that is just a tip of an iceberg, and we never get to see the full iceberg. That's why there is an urgent need to focus on animal, human, and the ecosystem interfaces so that we are able to launch an informed response. Next slide, please. So I come from the Indian Council of Medical Research, which is an apex body for formulation, coordination, and promotion of biomedical research under the Ministry of Health and Family Welfare in India. ICMR is a 100-year-old organization, supports the basic epidemiological and operational research in the areas of national public health importance, and provides evidence for to facilitate policy formulation, whether it is through drug trials, vaccine trials, trials for introduction of new diagnostics, providing guidelines, doing outbreak investigations, and the latest one, ICMR has been at the forefront of COVID-19 management in India. Next slide, please. So why should we be talking about antimicrobials? Antimicrobials is a very broad group of drugs, which includes antibiotics, antifungals, antivirals, and actually, if you see, it is a foundation of modern medicine. However, when the microorganisms evolve and they are able to resist death by the antimicrobials, that is when we say that a particular microorganism has developed antimicrobial resistance. This is a direct consequence of excessive use of antimicrobials. And what is unfortunate is that it is compromising the gains that we made globally towards the control of infectious diseases. All the diseases, malaria, tuberculosis, are actually bearing the brunt of development of drug-resistant infections, and we are not able to treat the patients who develop the MDR or XDR pathogens diseases. Besides that, it necessitates that we curb the trend of increasing antimicrobial use, and this requires One Health approach. This is more important in today's time because COVID has seen a lot of antimicrobial use, excessive antimicrobial use across the community, across the hospitals. And in a couple of years' time, the fear is that we may be running out of the existing antimicrobials. The antimicrobial resistance affects the achievement of sustainable development goals as well. And the good health and the well-being is one of the most important goals that we will be missing if we do not address antimicrobial resistance. Next slide, please. So ICMR is working on different aspects towards containment of antimicrobial resistance. And one of the most important is generation of reliable evidence, improving the diagnostic and the antibiotic stewardship, improving the infection control, understanding mechanisms of resistance, and basically trying to integrate the containment strategy using the One Health platform, and at the same time supporting the basic and the clinical research. We work with different partners globally. Next slide, please. Now, what we are addressing at Indian Council of Medical Research is only one aspect of AMR, that is the human and the clinical aspect. The fact remains that only 30% of the antibiotics are used in the humans, while 70% of antibiotics are used in livestock, fisheries, and poultry. In the last few years, there has been increase in 36% increase in the antibiotic use in the humans and almost 60 to 70% increase in case of the animals. Lot of antibiotics which is used in animals also and the fisheries also flows into the aquaculture. It is excreted through urine and feces, and as a result even the environment is full of sublethal concentration of antimicrobials which lead to development of drug resistant pathogens. Next slide, please. Why are antimicrobials used in the livestock or in the animal sector? They are actually used in the most of it is used also in the low middle income countries where the sanitation and hygiene is compromised, and antimicrobials are used to compensate for that. They are also used as growth promoters. But the fact remains that in US, 75% of the antibiotic use is in animals. Similarly, in very developed countries of European Union also, 70% of the antibiotics are used in the animals. In 2030, it is estimated that it will increase by 82% in India, 59% in China, 41% in Brazil, and 22% in US. Reason being that the affordability has gone up in the low middle income countries. People are spending more on food, and the demand of animal protein has gone up in last few years, especially post COVID, when everyone is worried about nutrition and their well-being. Next slide, please. So through this, you can see that there has been a phenomenal increase, almost double the consumption in India and China and other countries which are low middle income countries, while the increase is not that much in the upper middle income countries. Next slide, please. So what happens when there is an excessive antimicrobial use in the poultry, the livestock, and the fisheries? That these antimicrobial residues enter the food chain and they reach humans. At the same time, because of the use of high concentration of antibiotics, all these food products also sometimes carry pathogens which carry the antibiotic resistance genes, which are then subsequently transferred to humans. Now, resistant bacteria have been detected in everything: bovine, chicken, the fish, and the related food products, pigs, horses, donkeys. Different kind of pathogens, for example, corns, Staphylococci, E. coli, Staph aureus, then Campylobacter, Salmonella, all these are transmitted through food products to humans. Next slide, please. There has been enough evidence for that. Next slide, please. Now, this is the pathway, how it goes, how everything, the agriculture, environment, food processing industry, and the humans are interconnected. There are antibiotic resistance genes, there are antibiotic resistance bacteria, and they just move from, for example, an antibiotic given in a livestock. It is excreted in the feces and the urine of the animal. It goes into the soil. From the soil, it leaches into the water bodies, and from the water bodies, it also enters humans. So this is how this whole thing is intertwined. Antimicrobial resistance hence cannot be addressed in isolation and needs a One Health approach so that there can be a holistic containment. Next slide, please. In India, we have been taking few steps, especially we have been able to establish a whole genome sequencing based surveillance. We have been undertaking efforts for capacity building of veterinary labs. India has done well on the regulation side. We have been able to ban colistin, which was used a lot as a growth promoter. Now it is banned to use that in India. There is now a mandatory withdrawal period for use of antibiotics in food producing animals. We have been able to specify the limits of antibiotics and other pharmacologically active substances in seafood. Then there is restricted antibiotic use in aquatic animals for export. And we are monitoring the antibiotic residues in eggs, honey, milk, and poultry. Next slide, please. So the impact of AMR is inadequately recognized by stakeholders, and there is thus minimal effort to understand and to contain it. Addressing AMR is a huge challenge. Looking at the kind of ecosystems which are involved and how the antibiotic resistant bacteria travel between these ecosystems, we need a very holistic and a comprehensive approach. For that, we need unequivocal political leadership and commitment, strong policy and regulatory frameworks, and adequate human and other resources so that these policy and regulations are enforced well. Hence, what we can do is generate evidence which influences policymakers, identify the links and contribution of AMR with SDGs, especially post-COVID, and present it to the policymakers. Research on good policy practices, basically any case studies or country examples which have been able to mitigate the threat of AMR by reducing the use of antimicrobials in agriculture system and environment. They should be showcased. And the most important is raising the awareness and communicate the importance of One Health approach in addressing AMR. One thing which we have not been able to convey about antimicrobials is that it is a natural resource. Just like your food and air and water, we are very worried about the quality of air and the quality of water. Similarly, we need to worry that antimicrobials is not a resource which is unending. We are almost at the fag end of all the antimicrobials which have been discovered in the past. There are very few antimicrobials which are in the pipeline, which might see a market in next few years. So till then, we need to judiciously use what we have. Wherever we are using, we need to use it in a targeted and a very specific way. So the idea is to generate more evidence, have more engagement and intersectoral collaborations, and educate all the stakeholders, communities, everyone, so that we are able to progress towards an efficient containment of antimicrobial resistance. Thank you.
Wow, yet another incredible, incredible keynote speech. Thank you so much, Dr. Walia, for sharing your knowledge, your passion, all the way coming from India. Thank you so much. I am sure plenty of people will have questions. So again, reserve those for the question and answer session and the panel discussion. That was really wonderful. And it really drives home the point that with such complex problems like AMR, antimicrobial resistance, we really have to have a One Health approach. The way I define One Health approach to even 6-year-olds is teamwork, right?
Yes.
Teamwork between people of various backgrounds, strengths, disciplines. We come together and we combat and prevent complicated health problems. So Dr. Walia was speaking about the importance of the environment and how that has a huge role in antimicrobial resistance. And she even had an image from UNEP. Well, UNEP is the United Nations Environment Program, which our next keynote speaker is coming from. So please welcome our third and final keynote speaker, who is Doreen Robinson. She is a conservation ecologist with over 25 years of experience linking environment and sustainable development. She is the head of biodiversity and land management at the UN Environment Program. Let me just say that again. She is the head of, biodiversity and land management. It's massive. We are very lucky to have her here. This place is where she leads the One Health work and focal point for nature-centered pandemic recovery. Prior to joining the UN team, Doreen Robinson served as the regional chief for environment with the United States Agency for International Development in Pretoria, South Africa, where she was leading programs in biodiversity, transboundary ecosystem management, combating wildlife crime, water supply and sanitation, water resource management, and climate and energy in 15 countries for nearly a decade. Wow, I am looking forward to this conversation later on, and particularly this upcoming keynote speech. Let's all please welcome from around the world, Doreen Robinson.
Thank you so much. I don't have any fancy slides for you, so you're all going to have to look at me for a little bit, but hopefully I'll keep you entertained. Thank you to the organizers, and thank you to those powerful ladies who spoke before me. It's really an honor to be with you on this panel. Like Sharon, I actually started my life thinking I was going to be a wildlife veterinarian, but then I changed and moved into conservation ecology. And the combination of being a conservation ecologist and then spending most of my career as an environmentalist working in a human development context with more human-focused agencies, those two factors together have really combined to lead me down a path where I really believe that interdisciplinarity and systems thinking are essential to solving the world's problems today. So I want to talk a little about One Health. Healthy people can't thrive on a sick planet. That's the reality. And we are currently living on a sick planet. Nature provides jobs and income, and the environment makes an enormous contribution to human health and well-being. Our lives, our future, I think Sharon said this, our very lives depend on it. Over 55% of the global GDP is attributable to nature in some way. That's at least $44 trillion. It's dependent on nature and its services. 60,000 species are used for medicine, nutritional, and aromatic purposes, and more than 500,000 tons of these materials from those species are traded every year. 56 million people are directly employed in nature-based endeavors such as fisheries and aquaculture, and 880 million people are dependent on those sectors, fisheries and aquaculture, for their very livelihoods. Globally, 35% of crops depend on pollinators, and 1/3 of the human diet comes from insect-pollinated species. But unsustainable economic activity is driving nature loss faster than ever before. The triple planetary crises, that's what we talk about at UNEP, of biodiversity loss, climate change, and pollution, are diminishing healthful benefits of nature, and they're increasing risks to human well-being and driving potential public health concerns. 9 out of 10 people worldwide breathe polluted air. It causes 7 million premature deaths annually. 2/3 of our freshwater resources are under stress, and 500,000 people die each year from diarrheal diseases from contaminated water. A football pitch of tropical forests is destroyed every 1.5 seconds, and 1 million species of plants or animals are at risk of extinction. So human, animal, and planetary well-being are inextricably linked. We simply cannot achieve one without the other. And this is the core premise behind UNEP's approach to One Health. So to achieve a holistic view of health, what do we need to do? So first, I kind of hinted at this. First, we need a systemic approach. One Health is more than the sum of the separate domains of human, animal, and environmental health. A true One Health approach focuses on the interrelationships and the interdependencies of these different domains of health. Let's take zoonoses, for example. In the UNEP's report on zoonotic disease, we identified 7 anthropogenic drivers of the increasing emergence of zoonotic disease. Those drivers are increasing human demand for animal protein, we heard about that, unsustainable agricultural intensification, increased use and exploitation and overconsumption of wildlife, unsustainable utilization of natural resources accelerated by urbanization, land use change, and extractive industries, increased travel and transport, changes in food supply and demand, and of course, climate change. These analyses tell us that we need doctors, veterinarians, farmers, wildlife managers, agribusiness, and many other people around the table if we're going to solve the problem. One of the challenges I've seen as we've engaged in the One Health approach is that it doesn't work if each sector goes about doing its own thing and then assumes it's all going to add up. That's not a One Health approach. The challenge for environment is a little bit harder because a lot of the One Health approaches to date have focused on animal and human dimensions and have not focused on environmental dimensions. In my own experience, I've been in a lot of conversation where there's a recognition that the environment dimensions have been underdeveloped or in some cases ignored, and that they are important. But sometimes those conversations become simply a dialogue about, here is a list of things that we have said are important for human and animal health. Can you just add on the environment part? That is not going to work. We have to reframe the problems. We have to understand the system with a truly holistic approach. And that can be a real hard pill to swallow in the context of a lingering pandemic where we're hearing in the media the next pandemic is potentially around the corner. But without that rethinking and reconnecting the dots between humanity's relationship with nature, we will not get to a true One Health approach. And we will forever be chasing the next illness or disease. So to apply an approach, what do we need to do? We need more multi-sectoral collaboration, particularly on assessing risks and hazards for health, all those dimensions of health. We need to break down cultural, institutional, and technical barriers for cooperation and provide real incentives for doing this. And those incentives have to be financial, reputational, and policy-driven. And of course, a starting point for cooperation is always communication. We need a common language to work with. You would be surprised what happens when veterinarians, ecologists, and medical doctors get in the room. The second thing we need to do is have evidence-based policy responses grounded in science. We need a stronger evidence base for the complex risk profiles and the ability to assess costs, benefits, acceptability, and scalability of our solutions. I'll give the example of wildlife trade. Globally, we know that wildlife trade is a source of livelihoods, income, and food security for millions of people. And in turn, those benefits provide positive incentives to support species and ecosystem protection and conservation. At the same time, we also know that overexploitation of species, poorly regulated trade, and of course, illegal trade drives biodiversity loss and can increase the risks from zoonotic diseases. In 2018, the total global value of biodiversity-based exports, that's both animals and plants and their products, was $864 billion US. Canada, for example, accounted for just over 41 billion of that. That's a huge legal trade, and that's only the export trade. The value of domestic trade, in some cases, incredibly large. But numbers don't tell the whole story. We need to know what the numbers mean in terms of jobs, the benefits that flow to local communities, the incentives and disincentives that might be created, but to keep an area in a wild or conservation state versus some other alternative land use. And of course, the skills and capacities to effectively and sustainably manage that trade all need careful consideration. Some contend that stopping the wildlife trade is the solution to pandemic risk, but I can tell you it's not. Pandemic risk is complex. And while better regulation, monitoring, and in some cases temporary restrictions may be helpful, it won't solve the problem alone. More so, we need to look at the implications of wildlife trade, not just on disease risk, but also on incentives for conservation and economic development to be sure that our policy options don't have unintended consequences. We know that sweeping bans on trade in West Africa during a past Ebola outbreak were not only ineffective, but they drove the trade underground, which increased the risk for humans, animals, and environment. So One Health, which is of course much bigger than addressing the risks of diseases with pandemic potential, has the world's attention. And now it's the time to realize its full potential. As I speak now, the UN's first food systems summit is going on right now. One Health is being discussed in the context of nature-positive, safe, and equitable food production. They're discussing antimicrobial resistance that we just heard so much about, which we know is killing 700,000 people a year, but it's also polluting water and soil that we needed to grow the food to meet food security needs for a growing human population. The Global Biodiversity Framework that will set the new goals and targets for halting biodiversity loss for the decade to come, and it specifically mentions human health and animal health in the framework. And it includes a draft global plan of action for biodiversity and health. Under the UNFCCC, the climate treaty, nature-based solutions or ecosystem-based adaptations are being considered as the way forward in national plans to address climate change and to halt climate change. And we know that climate change will affect human and animal health in so many different ways. And these same nature positive solutions are being discussed at the country level as part of pandemic and economic recovery. So the need for transformative change has never been greater. We can build back better, greener, and more equitably as we recover. The good news is that humans, while we're wonderful at creating problems, we also have it in our means to solve these problems if we look to science and evidence and work across sectors to tackle the root causes. One Health approaches are essential to doing just that. Thank you.
Wow, my head is spinning. There's so many thoughts in here, and I'm sure from folks around the world. Please, folks, if you have not yet shown your love, please do so, and also add your photo to your profile so we can see who you are and not just initials. It's so much better when we have a real conversation with people who have faces to their names. Doreen Robinson, that was incredible. Thank you so much. There were a lot of statistics in there, and we will be diving into those very shortly. So without further ado, our next part of the One Health Connect event is the panel discussion. This is the time when you all write in the Q&A section of the message area what questions you have. But if you don't mind, let's kick it off with a general question. There are so many incredible points that were made amongst these three phenomenal speakers. I wrote notes upon notes upon notes. One theme that was being reviewed in all three speakers was the idea of food security. So for the benefit of the audience, food security is not food safety. Food safety is like the cleanliness of meats, the cleanliness of milk and cheeses, and so that you don't get sick with salmonella and whatnot. Food security is having access to food. Okay, so totally different. If there's no food around you, well, then your food security is poor. So we spoke a little bit about the wildlife trade and how that plays into the economy, and then let's dive into the food security conversation. I would say that throughout the world, different populations in every country, even in the United States and Canada, there's scarcity of food in certain populations. It is a hard nut to crack, as in we have to have a systems thinking approach. Who are the professions involved in handling such an incredibly massive problems such as food insecurity. And I invite you all of the participants on here, everybody listening, to also write down in the chat box not only where you are coming from, as we did before, but also what's your background? How are you coming to this One Health conversation? From what angle? Out of the three speakers, anybody interested in starting that answer? Yes, Dr. Deem, thank you.
Sure, I love starting the panel with this question because I'm sure it's near and dear to all three of our hearts. I guess to answer it, not going into the disciplines and all, one of the things that I do quite a bit when I teach One Health with the next gen practitioners is to remind us, everyone in this conference right now hopes to eat today, right? I mean, it's the one shared thing we hope to do today. And this sort of gradient of what our relationship with food, from the food insecure and some of the issues across the planet of not enough food, to the overconsumptive in the country I'm sitting in now, the overconsumptive, poorly use of food, whether it's too much protein intake and factory farming and all those things. So I think when we think about food security, we should think across that whole gradient, and we should each as individuals take the power of what we eat and realize how much that does impact this food security question. And so I just put that out there. It's not answering your question, Deborah, but as something we should all think about. And that question is so important from a One Health angle.
Yes, please. Kamani Walia, please.
So food security has been, in the forefront of the discussions related to climate change as well. Following the climate change, there has been a reduction, I think, in the nutritive value also of some of the crops that are being raised in different parts of the world. There has been decline in the overall production of some of the grains as well, for example, rice or maize. And this is a well documented. This has been very well documented by many UN reports. So whenever there is this kind of a food scarcity, just like water scarcity, which is also being driven by climate change, then there is also a shift towards different kind of foods which are unsafe as well whenever there is not food available. Probably that has also led to emergence of some of the zoonotic infections which jump, because when you depend on wildlife for food consumption, different viral outbreaks have been a result of that. So as Dr. Deem mentioned, we have to put a more thought into it, how we can give it a more holistic approach where all the countries, it's not like developed or developing countries and upper middle income countries or lower income countries. We all have to get together, because there are enough resources, I think, which are available for everyone. It's just how we position them and how we utilize them. That of course is the end of the supply chain, but then there are other issues that would really need to be addressed, because changing the crop patterns, changing as per the season, because there's so much change in the climate, which in India we are seeing. I mean, at this time we are having excessive rains, which was never there before. So this ultimately affects the food production, is the first one which gets affected, because many of your crops actually depend on irrigation, and it is not really receiving any other water from any other irrigation source. Thank you.
Just building on what was just said, I mean, I think this point about the spectrum is so important, because there's another aspect of food security, which is also nutrition, right? And when it comes to One Health, we have a number of issues, and it's, again, a spectrum. We have folks in some places who have an obesity problem, and then in other places we have actually, as much as sadly, a starvation problem. So again, this holistic approach of looking at the sectors when we're thinking about food and One Health becomes so important. But the other thing too is, I've done more on this One Health. I hear a lot about this micronutrient deficiency that millions of people around the world are facing. And that reality has gone to the way we think and interact with food on this planet. And part of that is, I wish I had the number in the top of my head, but there are thousands of species that used to be part of the human diet and have the potential to be part of the human diet, thousands. But if you look at what we're consuming across the planet, and this really does cut across the entire planet, it's a handful of species. That's it, that we're over dependent on. And so I think there's a whole rethink that needs to go on about our relationship with food, wherever you are on the spectrum, and start to kind of, what else is out there? Nature has all this potential and genetic diversity and high micronutrient diets, and yet we're going for, antibiotic induced similar species that are crammed up in cages. I mean, these are kind of realities that we have to think about. So who needs to be part of it? Because I am going to try and answer your question. I mean, it's everyone, right? It's voting with your fork, or if you don't use a fork, or use your own, vote with your hands, however you eat your food around the world. But there's the role of the consumer, but there's also the role, the one we talk about a lot, is the farmers and practitioner and people who are actually growing our food. But then there's all those middlemen who are shipping it around the world and transporting. And then you go all the way up to the big agribusiness and investors in those businesses. And we have to, if we're going to shift the system to be healthier for animals, people, and the planet, then we have to engage at all those levels in very smart ways. And so it's quite a big dialogue.
There is so much to pick apart from all of your responses. We could last for weeks talking about this, and that's people commit their careers to this. But let's take some of the things that were just said, and further the discussion, because I would love to hear what your thoughts are. So we're talking about, I'll take one thing from Dr. Deem and one thing from Doreen Robinson that was said. So Dr. Deem said, I start by talking about everybody wants to eat tonight. And then what Doreen Robinson was saying was that we have to, translating it a little bit, we have to have the nutrition discussion. And taking those two into account, what I heard between the words is that what we really have to do is focus on communication. And we have to think about the bottom up approach and the top down approach. Now, when Dr. Deem was saying we have to find food for tonight to eat, that relates to our own needs. That makes it personal, a personal mission. And what Doreen Robinson said was talking about nutrition. Everybody knows what nutrition is. They may not be specialists in nutrition. They not necessarily want to eat well or have good nutrients come into their body, but they understand it. So these are words that would be incredibly powerful. My follow-up question is, when we are trying to change the world, do you think that it is equally as important or more important than others to either work from the bottom up and change communities, change minds of influencers at the community level, or change the influencers' ideas at the policy level, but knowing that you might be running into some landmines politically? So I know it's a loaded question. The answer could be both equally important. But from there, I want to explore, how can we actually take action? What's a meaningful, I want people to leave today and be like, okay, these are the 3 things I'm going to do. So feel free to start off the discussion. I'm happy to listen.
I can start. So, yeah, top down or bottom up? I think I would choose bottom up, because when there is a demand, it becomes incumbent to create a supply. So that's the way I look at it. So when there is more awareness about a problem when there is a demand, that, okay, we need food security, we need clean water, we need vaccines, we need good treatment, good health care. That's when, the policymakers, it is incumbent upon them to create systems. To be honest with you all over here, the colistin ban in India came around when actually there was a demand that, there should be a colistin ban. We should not be using that drug. The doctors demanded it. The patients needed the medicine. And here we had colistin, which was coming in the animal feed. The animal feed was coated with an antibiotic. So that's when, it was a bottom-up kind of a thing, and the matter was brought to the attention of the policymakers. So I would, in any case, support a bottom-up kind of approach, and I think the top needs to put its act together once there is a demand.
Could I jump in?
Please do.
Yeah,
yes. Thank you.
So I maybe it's the ecologist in me, but I always think the world is full of false dichotomies, and I don't think it's one or the other. I think it's both. And a matter of fact, it's a sandwich. There's something in the middle too. Unfortunately, I think when you're in a crisis, the top makes a lot of noise and gets a lot of attention. And that's really important to get it right, but also in a crisis. On One Health right now, some of the dialogues that I'm in on One Health are not really One Health dialogues. They're like a piece of it. One Health is either as big or as small as you want it to be, and that's not always helpful. The other thing that I'm really concerned about is that bottom-up voice has to be heard, because One Health has to be so contextualized to the realities that are faced, both the realities of what, again, the challenges are and the realities of what the capacities are and the abilities to respond to them. And so if you have a top-down approach, you're going to miss that richness and nuance. So for me, it's about putting that together and making sure it's sandwiched in the middle, and that piece in the middle is making sure that whatever we're learning on the ground is feeding up and informing top-level decisions and priorities and structures and institutions. But that sandwich in the middle also has to feed down those enabling environment so they can improve those realities on the ground.
And I'd like to wrap us up with this. I love everything that's been said so far. We talk about this a lot in our One Health courses. And one of the things I'm hearing from sort of the younger generation is, corporations have to do it. The corporations are making billions of dollars and they have to do it. But I love what both of you just said, because the corporations listen to the little person, the regular person, the us's of the world, right? The people that they are doing their corporations for. And I really would like to just, again, challenge all of us to realize we are the ones who rule the world and run it when we make those decisions that make those bigger corporations listen to us. And I do think, and I think it was you, Doreen, who said it during your talk, this moment, this COVID moment is a wake-up call. People are talking about One Health, from the billionaires of the world to the people trying to survive on the street. And if we do it properly and realize along that continuum that keeps getting mentioned, everyone has a role to play to change and make those One Health kind of solution changes that needs to be done from the bottom to the middle to the top, I think was just said.
Did you all hear that? I just heard a microphone drop. So I think we're good. Nothing more needs to be said. That was incredible. Yes, I see a lot of wonderful reactions. So let me just share a personal story with us all, because we're all friends here. We're all advocates for One Health, so therefore you are friends. And please connect with your friends on LinkedIn and social media, because that's why we're here discussing this, right? But just a very short personal story is, after I finished veterinary school and when I was learning about One Health in veterinary school, I was thinking, my gosh, why didn't I know about One Health 20 years ago? Okay, when I was a child, why didn't I know this? And then I went into clinical medicine, and I was thinking, okay, someday somebody will create lessons for children and try to get that bottom-up approach, and they'll learn about One Health when they're 6 years old. And I was waiting and waiting and waiting. And finally, I'm like, you know what? I'm just going to do it. And from there, One Health Lessons was born. And then go to onehealthlessons.com and you'll see all the incredible things that that organization is doing. But I was just one person on the couch with a dream. Okay. I am normal like you guys. I have failed plenty of times. I have succeeded on occasion. Just know it doesn't take a superhero to make substantial changes. Okay. So if you remember nothing else, please remember that. Okay. So it looks like a quick question for Dr. Walia about antimicrobial resistance. So it looks like the question is, do you think that our behavior, us throughout the world, towards foods nowadays is really one of the main reasons or drivers behind mass production of food? And from there, is that increasing the amount of use of antibiotics in livestock? I'll also just add on to that, are the antibiotics that are used in livestock of substantial importance of the really troublesome antibiotics that are seen in people? Or if you can just help us understand that a little bit. And then after Dr. Walia speaks, I would love to hear opinions from the other two speakers. Thank you.
Thank you, Deborah. Yes, this is a very important question. Why should we be using so much antibiotics in the livestock or in the agriculture as well? Many of you may not know, a lot of antifungals are used in agriculture as well, because fungal infections are very, very common in the plants. But why should we be using so much antibiotics? Antibiotics have multiple uses. They can be therapeutic. If an animal is diseased, there is no other option. Just like when we are diseased, we need an antibiotic. The animal also needs an antibiotic to be treated. But then there is a lot of prophylactic and metaphylactic use of antibiotics, which is given at a suboptimal concentration. This is to prevent infections in the groups, because when you have the compromised sanitation and hygiene, and also in the weather like in South Asia, which is very, very tropical, and it kind of encourages the spread of these kind of infections, there is a tendency to use suboptimal concentration of antibiotics for prophylaxis, or what you call as a prevention of diseases. So now there is a good amount of understanding. Initially, a lot of antibiotics was used as a growth promoter as well. Many antibiotics, they said they promote growth. As most of you would know, chicken is the most effective means of converting your investment into protein. There is no other animal which actually converts it so effectively. The amount of funding invested and the output in the form of protein that you get, chicken is most effective. So in a way, it is the money well spent, but then a lot of antibiotics go into it, which is what makes it unhealthy. Sometimes there are a lot of antibiotic residues, as well as the transfer of antibiotic resistance genes. So I agree with the question that definitely there is a push to increase the production as much as you can, because you want maximum returns on your investment. And I mean, you are willing to go use anything which is there to help you achieve that. But then the growth promotion part is now being scientifically challenged. That 30 years back, when antibiotics were being used for growth promotion, they actually offered that benefit, which is not being offered anymore because of so many other genetic modifications that have happened. But then, the same thing that we were discussing a few minutes back, the communication of that hasn't happened, and the antibiotics continue to be used as a growth promoter when they have really actually lost their value. There is a full report by, I think, OECD a few years back, where they looked at what is the investment in using antibiotics and how much do you get advantage in terms of growth promotion, and they did not find any evidence.
Yeah, so, for UNEP, we always talk about AMR, antimicrobial resistance, as the silent pandemic. COVID's gotten a lot of attention, but it really, AMR is something that we all should be worried about. I think the other reason is the idea of ecology and persistence. These antimicrobials And the superbugs are persisting in our environment. So even if we stop our behavior now, they're still around for a long time, right? So it does increase the urgency. But the other thing too, that because this constant desire for cheap everything, cheap protein, I think is driving it. But the other thing that I would say, I think it's our approach to health and food, and our food and nutrition is part of that. Our approach to health is so often about preventing and treating diseases or illness versus a really holistic view of what does well-being mean for a person or an animal or a planet. And I think if we shift our lens that way, we might make different choices about the way we produce things, the way we consume things, but it's that shift in thinking that I think we need. And that's what I think One Health can offer if we get it right.
And I will take up the end on this too. Again, I love everything that's been said. I think, the question was so good, and I think the question was so correct. Yes, it is impacting, right? And as has been stated by both of you, I would love to just add on to what Doreen just said. There's this growing One Welfare movement, which is sort of an offshoot of One Health, right? And just as you were saying, Doreen, I don't want to live in a planet where all we are doing is mechanizing and crushing in sentient beings so we can have cheap protein, as was just mentioned. There has to be this look at well-being and welfare of life on the planet. And really, AMR is this silent pandemic that really is reminding of us. Lastly, I'd say, COVID has, as has been said before, COVID has woken us up. We're talking about the wildlife trade. We're talking about spillover from that side. I would, again, challenge all of us to realize the spillover from the domestic animal side. And and AMRs can be thought of as a type of spillover, as can those infectious diseases. So again, we're all circling right back to that food question. For feeding 7.8 billion humans, how do we do it without killing the planet? And I think the discussion is asking us to think of that question.
Wow. I feel like it might be cheesy, but just go with me. If all of what are we at? 106 people on the line right now. If we can all say at the same time, One World, One Health, just on the count of 3, I think that would be incredible. You don't necessarily hear everybody, but let's just say it on the count of 3. 1, 2, 3. One World, One Health. Wherever you are on this planet, we're dealing with the same things, because bacteria, fungi, viruses, they don't know borders. And that's not the way this planet was built, right? There is no such thing as borders. Things travel. And the nice thing is that knowledge travels too. So let's move on to the next question. And then I also have a question after this one. And I want to see a vote in the chat box if you want me to direct it about antimicrobial resistance or biodiversity. So I'll be looking at that chat box. So take a vote, antimicrobial resistance or biodiversity, for the follow-up question. Okay, but this next question is coming from the audience. And it is, how do you suggest antimicrobial resistance can be tackled in the second largest country of the world, especially when the pharmaceutical sector is scattered in following the rules, and on-the-counter drugs are still freely available? And this comes from somebody from the United Kingdom, an MPH student. So just to reiterate, so this is a antimicrobial question talking about how the pharmacy sector seems to be quite not only powerful, but also a bit scattered, and about counter drugs. Oh, like over-the-counter drugs are still freely available. That's what the question is. Okay. Anybody, you're welcome to answer that.
I think it's meant for me, so I would take it, because it's
Thank
for
you.
India, second largest country, having the third largest pharmacy of the world. So we also manufacture a lot of drugs and we export them and then we use them as well because we have the highest rates of antimicrobial resistance as well in the country. And the speaker is very right in pointing it out that antibiotics are available on the counter. But then we have been able to create one classification in which the broad spectrum antimicrobials and the higher generation antimicrobials are available only on the prescription. Now the regulations are made, but then the implementation really needs human resources and the frameworks to implement them effectively. And that's where the country is struggling with. Some states have implemented it very well. Other states are still in the process of putting those processes together. As I mentioned in my talk, we have been able to put a ban on the colistin use. We have been able to ban many inappropriate fixed drug combinations of antimicrobials which were available in the market. So these are some of the steps which have been taken, and we hope to make an incremental progress as we move forward.
Thank you. Anything else to add? We're all happy with that. Okay. Thank you very much, Dr. Walia, for answering that question. Okay, so it looks like based on the results from the chat, people are interested in the biodiversity question. Okay. It's not necessarily a trick question because biodiversity is just an example, but this is a general question. When it comes to complex problems, complex One Health problems, we always have to use a systems thinking approach, right? Because it's not just a single problem. It's like a problem with its little legs going to other problems. For the general public, if we want to go from the bottom up approach, we have to communicate well with the communities, with the community leaders, with teachers, with students, with families. The problem that I was running into a few years ago when I was explaining how biodiversity plays a role in our own health, it took several steps to get there for the general public. Not only does the general public not necessarily know what biodiversity is, they know what bio is, they know what diversity is, but what's biodiversity? So going back to that question about communication and reaching outside of our bubble, how, in your opinion, do you think we as people who understand One World, One Health can convey this message of biodiversity and the importance of that? And if there's something to add, I'm happy to add that too, based on my experience teaching children about it. But I would love to hear from you three. Yes, please, Dr. Deem.
Sure, I'll start us off. I think this is a fantastic question. It's not a one size fits all because it definitely depends on the age group you're speaking to, the culture you're in. I mean, we all realize this. I do think that the sort of some of the key measures that I think have worked with the interactions I've had with the public, whether it's here in the US or any other country where I've worked around the world, is really to bring it down. You know, we just said biodiversity. That word scares people. So we don't even have to call it biodiversity. We just have to call it life on the planet, the species that make up life on the planet or something. Ecosystem services, which many of us are familiar with, we don't have to call it ecosystem services. We can just remind people or let people know how biodiversity is leading to provisioning and regulating and cultural and all those services it provides to us at that level. And then lastly, I'd say the one thing that seems to work across the board is bringing it into some kind of real life story. And we use a lot of different ones. One recently during Zika here in the US, the Zika virus is really tying in white nose syndrome, a fungal pathogen of bats that has led to the decline of millions of bats in our country, in North America. And then what do bats do? Well, they eat pests and mosquitoes. What do mosquitoes do? They carry Zika virus. So by this One Health story of understanding why, wow, bats are actually important because they're protecting me from this new emerging pathogen, Zika. I mean, that's just one example. And I know we all have stories from our own countries, and there are so many of them. But when you tie it into something as simple as that, suddenly I see light bulbs going on with whether I'm talking to a kindergartner or, I'm going to an assisted living home here in St. Louis. So people get it when you put it in story fashion and real life story fashion.
It's funny. Most of my career has been devoted to environment, but sometimes I actually find it's environmentalists who struggle also with biodiversity. Can't tell you how many I found where they're like, oh, biodiversity, you just mean species. You mean elephants and lions and so the whole fact that biodiversity does include these things, it's about systems, it's about services, it's about the genetics and the resource that provides. I've had to explain that to people who are world-class. The world-class climate scientists may not know what biodiversity is. So we have to make it something accessible to people. We're kind of shifting our dialogue. It gets a little tricky because you'd be surprised sometimes in the international community and with translations and everything. If you shift your words, you may not realize you might be talking about different things. But it is about nature and life on Earth, right? And what that means. The other thing we forget so often as humans, we are part of biodiversity. We are not separate from it. Some cultures are much more closer to it and they're living with it every single day. And they think it's crazy to, think about humans separate from nature. Other cultures, I grew up in New York City, and so the Bronx Zoo was where I was zookeeper once. That was my biodiversity for a while, and so my connection with nature was very different. And we have to respect that in how we communicated. And that was my other piece. It's not so much what we say. I find so often, particularly because I tend to deal in expert-driven discourse, is when you're dealing in an expert-driven discourse, people's starting point is so often what they want to say. And I think we need to start from what do you want people to hear and understand. And when you start there, that kind of empathetic communications, you choose your words differently. And that's where the power of storytelling, the power of connections, like the whole point of communications, right, is to either be understood, but we forget that sometimes because we're so caught up in what we want to say. It's a crisis, do this, do that, and then we throw lots of words and sound very smart. And so I think how we communicate and really starting from the other side is super important. And particularly in One Health, because I said, when you put, and I said in my talk, when you put a bunch of ecologists and veterinarians and medical doctors and virologists in a room, you'd be surprised where all of a sudden you realize if you're listening carefully, you're not actually talking about the same thing anymore because we all have our dialogues that are going on. So part of it is you have to start the conversation by being very clear what you are talking about and checking to make sure people are hearing what you're talking about.
Yeah, my brain just exploded. Yes. Yes, I agree with you. And that reminds me, with One Health Lessons, we have a book club for the lesson leaders and ambassadors. And for the last few months, we've been talking about communication and how it's not just the message that you are intending to share. It's the message that your audience is hearing and absorbing. Can be two totally different things. Great. So we have just 2 questions left. One of them is coming from the audience, from Kenneth in Ghana. Okay. In your opinion, how best do we move the One Health approach from the conversations to intentional implementation? So it's not just about talking, we're actually doing. Anybody is open to anything?
I'll jump in. I'll jump in a little bit. Well, one thing we're thinking about a lot is, first of all, you have to operationalize everything. You have to understand what is already on the ground. So part of it is just looking at the institutions and the culture of those institutions and the science of those institutions and starting to figure out how to get that discourse we're talking about, that conversation going. And it has to be incentivized. People are environment ministries, health ministries. Everyone has a job to do. And no, it's everyone's problem, but nobody wants somebody else's problem on top of what they're already doing. And so it's about finding these ways to come together and discuss those common goals and let everyone do what they're supposed to do. That's the other thing. I don't have to understand One Health the same way you understand it as a veterinarian, right? Or you as an AMR specialist. But I do have to understand what I can bring to the table to find these common solutions. So I think it's facilitating these processes. And I'm a very firm, we've got to do it on the ground level. It's great to have these, and we have to have the enabling minds, but if we don't do it on the ground, it will never be real. It will just be an idea.
Yeah, and I'll just add to that. So agree with everything stated. And I think, Doreen, when you answered the last question too, I think the sort of semantics and understanding and speaking the same language is so important with these disciplines. One of the things I'll say is I really think a few decades ago, not that long ago, we all became so siloed. Medicine became siloed. Veterinary medicine became siloed. I'm sure other disciplines became siloed, and that really impacted us. Now we're becoming, the younger generation, again, understands the need for a multidisciplinary approach. And so I think that intentional implementation is happening in many ways, and is almost what's considered a quote no-brainer for many people today. And we're starting to see some of those funding agencies fund in One Health programs or multidisciplinary approaches. They might not call it One Health, but it's that connectivity and that connection. And so again, I think that's a really positive thing happening today that we didn't see 20 or 30 years ago.
Yeah, I agree with both the speakers. I think we need to incentivize it. And especially after COVID, we know that, we have to address it. We can't afford to ignore it anymore. We have had many viral outbreaks in the past, which actually called for One Health kind of approach for infectious disease containment. But then did it really happen on the ground? Some attempts did happen, but then I wouldn't say that we had best of the systems now that we are in the middle of one pandemic. So this needs to be incentivized, and it's very important to highlight the success stories or the case studies which have worked, the processes and the frameworks which were initiated. Because one of the major criticisms for such multidisciplinary ambitious projects is that there is no guidance which is available. Even if one country wants to do it or wants to implement something, they don't know where to go. I mean, we are struggling in India to set up an integrated surveillance network for AMR. We did a capacity kind of understanding what kind of capacities are there in veterinary labs for integrated AMR surveillance. And we were not very happy with the kind of results, because it may be a top of the priority for a medical research which deals with humans, but it may not be a high priority for an agency which actually looks at the food production for the country. For them, AMR is a way below priority. So sometimes the priorities don't align. So bringing something like a climate change, antimicrobial resistance, zoonotic infections high in a priority list for all the agencies, which are national, international, philanthropic or not-for-profit. I mean, that's something that needs to be, incentivized and needs to be mobilized.
Thank you all for your answers on that. And I hear you say, how do we speak the same language? Well, let me explain what I have found in my career so far, jumping from speaking with educators to environmental health scientists to physicians and medical students. And I'm often the token veterinarian in the room. So what needs to happen is we have to be in the same room. We have to be in the same room. We have to have relationships between people of different backgrounds. We have to grow trust between each other. Once we build a relationship or friendship and expand your network, that's how we can start to really hear each other. At least that's what I've seen in my own experience. And it's really wonderful to see that we four are coming from different backgrounds, but we are speaking the same language, probably because we are so adept to having the One Health conversation. But for the audience members, this is not common. Oftentimes we speak past each other. And that's one of the reasons why I wrote this book. I'll talk about that later. So thinking about your network, you have the opportunity today to expand your network. So get your photos up on your profiles, get your bios up on your profiles, be a part of this networking event coming up very shortly. Because not only are you going to connect with people in your own country, you're going to be connecting with people around the world. And that is so meaningful because remember, it's one world, one planet, one world, one health. Next and final question. How do you see the future of One Health? Anybody can start this. Yes, please, Dr. Deem.
Sure. So since we're closing up also, I'd just like to say thank you. And I've really enjoyed this conversation and look forward to the networking time that we have after this. And, when in the end of our introduction to One Health text, our last chapter is the past and future of One Health. And so the question is, what is the future of One Health? Well, I kind of grew up in the day of conservation medicine. I remember One World. I also ascribe to planetary health, right? We have these names that are sort of coming and going and all sort of doing the same thing. Will One Health is One Health here to stay? And is the One Health approach here to stay? And again, I challenge all of us to ensure that it is. I mean, it is such a great mechanism, tool, movement, approach, whatever you want to call it, of how we work together to solve these wicked challenges. I also end a lot when I teach and when I think about it, and I give Abe Lincoln, who was one of the presidents in our country here in the US, credit with saying, you can predict the future by making it. And really, we as One Health practitioners, the 101 of us that are here right now, we are the ones who are going to decide what the future of One Health is. And so we will make that future.
I'll just add to that. The world is talking about One Health. It's in mainstream media, and in a way it never has before. This is the opportunity to get it right. So with the right incentives and with the right interests, and also, again, I think at this point, everyone has a role to play. It's such a complex problem, but it's all our problems, right? This is about food we eat. This is about people living and dying and getting sick. It's not someone's problem. So that's the reality, to mobilize that whole of society approach to it. Doesn't mean you have to understand, doesn't mean you have to do all of it, but the opportunity is now. And I say this because I have, members of my family who are in school, this whole movement towards interdisciplinary studies and thinking is a critical part of it too. And anyone out there who's thinking about, do I go narrow or broad? Make sure you at least go a little bit broad, because that's how you solve wicked problems.
Amazing thoughts from both the speakers, and I echo what they said. At this point, we can't afford to ignore One Health anymore, and there has been good amount of push from different stakeholders to move forward in this direction. And the way I see One Health, I see One Health has a brighter future than the past that it has had so far.
Wonderful. And somebody asked me, how do I see the future of One Health just the other day? And I said, well, compared to 5 years ago, it's looking much better. It's looking much better. And I can say that confidently because I've been fortunate to connect with not only a bunch of you, but a bunch of others around the world who are leading educational systems and community programs focus on One Health to get the word out there, to get people who who are illiterate, people who have PhDs, people of all different backgrounds and who have different priorities with the mindset of One Health. The environment plays a huge role in our own health. A sick environment can cause sick animals, can cause sick people, right? So it's having those open conversations. It's having those relationships. It's broadening the conversation, but we can also come at the conversation with our own specialty. So say, okay, well, I just got into medical school. I'm going to be a physician, and that's where I'm going to sit. Awesome. Good. Wonderful. Make sure that you continue the conversations with people outside your professional bubble, because we're all in this together. So without further ado, I now officially conclude the panel discussion, and what a discussion that was. That I absolutely loved it. Hopefully everybody else has. I see a lot of thumbs up and applause and woohoo. I don't know what you would call that, the streamers, and hearts and everything. So around the world, thank you so much, everybody on this panel. Thank you very much to the sponsors and the organizers for this. And the next step will be, I believe we're going to have a little, let's see, going back into the agenda, it looks like we are going to have some breakout rooms and starting the network session. Nusha, I know that you'll be taking over. It's been an absolute pleasure to lead this panel discussion, and I look forward to seeing you all in the networking event. Thank you again.
Thank you so much. Hi, everyone. My name is Nusha, and I'm VP Partnerships at Health Innovation Initiative. So I'd like to start off by thanking our panelists, our MC, our sponsors, and you for attending this engaging and thought-provoking event. But we're not done quite yet. I'm going to give you a brief description of how the networking session will unfold. So there are going to be 5 topics for the breakout rooms or tables. So you can choose a room based on your discussion interest or background, and some of these rooms will be moderated, some will not be. So there is general networking, where you can meet people and exchange information, connect with them. So again, please remember to update your profiles on the top right, include your LinkedIn profile, etc. Then there's One Health, where there will be a general discussion without a particular focus. And then the next 3 are human health, animal health, and environmental health. The duration of this session is going to be about an hour, and you can switch rooms at any time, but be mindful that each table only has a limit of 8 people. The sponsorship booths will also remain open during the session. And if you have any questions or concerns, you can please send us a message in the chat to any of the OHC 21 named staff. And please make sure that your AirMeet profile is updated, like I mentioned, with your relevant information and pronouns. Now, if you don't want to share your information on this platform, or even if you do, if you'd like to be part of a, let's say, program of sorts, where you'd be matched with people in terms of networking, you can send us a short bio at the email on the slide. So it's info@healthinnovationinitiative.com. And we'll usually take care of that after the event. Now, keep in mind that the next session is actually a 15-minute break. So please feel free to visit our organizer and sponsorship tables at the top of the social lounge. We'll then begin the networking session once the 15 minutes are up, and your room moderators will provide you with further details. See you soon.